Let's be honest here. Vaccines, especially those for young children, are no fun. But for the sake of the individual and the entire community, they are important.
We know that infant, toddler age range is a really vulnerable age group right now. They are the age group that we have had the biggest drop-off in vaccines for, so we know that we have about 40–50% of that age group in our community that are not up to date on their vaccines, making them vulnerable and the people caring for them vulnerable.
Measles is an example of a highly contagious disease that can impact our society. The disease can still be imported from areas that have measles circulating and can quickly spread in communities with unvaccinated people. But there are other, more common illnesses that can pose a serious health risk.
So let's talk about whooping cough, for example. Whooping cough, or pertussis, is an illness that continues to move throughout the community, and we see outbreaks every once in a while of this illness. This is an incredibly dangerous illness for infants. But it takes 5 vaccinations by the time they reach kindergarten for them to be considered fully vaccinated for kindergarten. And they don't start until they're 2 months old. So that means that those infants are still very vulnerable to that condition if they're exposed to it within the community by people who have not been vaccinated for it, but could have been because of their age. Another example of that would be the chickenpox vaccine or the varicella vaccine. That's one that children are not eligible for until they're a year. Well, that means they're very vulnerable until that time and are dependent on the people around them being vaccinated to protect them.
Healthier children now means less time missed at school, less time that parents are out of work, and it helps to create a better foundation for the child's future. Early childhood health care, including childhood immunizations, leads to better health as an adult, and according to Professor James Heckman, even impacts the economy.
There's a lot of scope which is not being discussed now about how early health can create later health, how early education can produce later health, how we can create a capacity which produces much less burden on the healthcare system and much more promise for the American economy.
To do our part here in Noble County, the health department partners with schools, child care facilities, and more to make vaccines more easily accessible for parents. They also have expanded their clinics around Noble County.
We have opened off-site clinics. We have a clinic available at the Kendallville Fire Department and at the Ligonier Fire Department, and we alternate weeks on that. So once a week we are at one of those locations, in addition to our regular vaccine appointments in Albion at the Noble County Health Department.